Very well. It's time for our interactive segment, Your Health. And like I had indicated this evening, today we are going to be focusing on pneumonia, particularly given that on the 12th of November, we will be marking the World Pneumonia Day. And sadly, pneumonia remains the second leading cause of death among children under 5. Why is this happening, given that there is a vaccine since 2011, that is about 8 years, we've had a vaccine against pneumonia, yet children continue to die? For those answers, we have with us in studio this evening Dr. Warurua Mugo, who is a child chest specialist. Thank you for joining us, Dr. this evening.
Yes, thank you, Tina.
We're talking about pneumonia being the second leading cause of death among children. What is the current prevalence rate in the country? How many children actually have pneumonia as we speak?
Well, in terms of talking about how many children have pneumonia at any given time, would be difficult because sometimes it is seasonal. There are some portions of a season where there are more children than the other portions of the season. But I think it's good to mention that pneumonia is a serious disease and it occurs throughout the year, and there are various causative organisms that do that. And of course, sometimes it has fatality. Fatality is that it could be a cause of death in some children.
What causes the increase? Because you're saying there's sometimes when it's high, sometimes when it's low. What are the factors then?
Good. We have seen pneumonia, especially sometime when the weather has changed, when it's a little bit cold, when it's raining, we get a higher influx of children with pneumonia. Although also, apparently, sometime when it's also very, very dusty, we get a number of children still coming over. Like we had about January, February, we had quite an upsurge of pneumonias that were quite surprising.
Yeah. How contagious is the disease?
It does depend whether it's somebody who is coughing directly to you, but mainly some of the school children who go to nursery schools or to kindergarten, when they come home, their younger siblings do get a bit of that infection. Which initially starts as what we call a cold, but it can proceed on now to pneumonia. But the cough or the cold is not the pneumonia. The pneumonia is the infection of the lungs.
So at what point should a parent be concerned?
Good. A parent should get concerned if a child is coughing, if a child gets a fever, and starts to have rapid breathing, and you actually notice other features like vomiting. And if the fever is very high, some of them can even get what we call a convulsion. At those stages, the parent should actually be very concerned and run for care in the hospitals.
In the hospital. Yeah. All right. We've talked about there being a vaccine for pneumonia since 2011. Why is it that today we are still talking about children dying as a result of pneumonia? Is the vaccine not working?
That's a good question, and for those of us in a pediatric area, especially the Association of Pediatricians in Kenya, we were extremely delighted by what our former president did in launching the pneumonia vaccine, because it has been observed. A lot of cases that used to come to the hospital because of pneumonia have gradually reduced. But we also need to know that that particular vaccine takes care of what we call the bacteria, but pneumonia can also be caused by other smaller organisms called the viruses. So it's not only that
it's not just
organism.
bacterial.
Yes. Yeah.
And what about now for the viruses? What's the prevalence rate?
Good. Reports that have come recently, and Kenya has been a very good example in terms of the results that have come from a place called Kilifi. It has actually been noted that viruses play a very major role than we thought before. We were thinking of 3 types of bacteria that were the main causative organisms. Maybe for this audience, I'll just mention there are 3. But studies that came from Kilifi and other parts of the world and they were put together, they did indicate that viruses do have a very major role in the causation of pneumonia, and actually also in fatality. Fatality is a pneumonia that will possibly lead to a child leaving us.
And a child leaving us.
Yes.
What about, in terms of access to treatment? Do we have, sufficient antibiotics for those who get infected?
That's a very good question. They've also been through what we call the distribution of medication through KEMSA and through the county governments. There has been a lot of effort that has been put in terms of getting accessibility to medication. And even in the last 2 to 3 years, there is a concerted effort to try to put the pneumonia medication to an accessible form, in a syrup form which comes as a tablet, can be mixed even in the lowest dispensary. So I think accessibility is there, although in some areas, I really must confess, many children don't get the right type of care because they don't get this medication. These are the so-called, the antibiotics that are supposed to treat the pneumonia, they don't get it. But it's not only the antibiotic. We also need oxygen sometime, especially in severity, and we need something to reduce the fever.
So how can we get, the medicine to the children who need it?
I think with the current arrangement with the county governments and with the county governors, I think with a bit of effort where the health sector within the counties are strengthened, there is a great likelihood that with a good distribution service right to the dispensary, most of the pneumonias are manageable. And it's a pity that we are still losing a huge number of children in this country. Actually, by the time we sit here with you and leave this station, a number of families will be crying because they have lost a child. I mean, that's how serious the situation is. But despite that, there has been some very major leaps and bounces in terms of the successes that we have seen in the care for the pneumonia.
Are parents getting, the children the help that they need in time? Because there's always also the challenge of diagnosis.
That's a good question. I think a number of parents may not, especially in a severe condition, may not fully be accessible to care. Because within our health system, we have the dispensary, we have the health centers, and I want to commend people who work there, like the nurses and the clinical officers. They do a superb job. But when a child has a little more complicated pneumonia, they need to move to a higher center. And sometimes the transport, sometimes the facilities that are needed, like the oxygen, are not always available. And worse still, even the so-called medications that are needed. I do hear complaint, like we get children who are delayed for so long. By the time they are reaching what you call a tertiary care, it's like the 5th or the 7th day, and that's a very difficult stage. Although they can get well, but it requires a lot of hard and concerted effort.
So how can we strengthen, our referral system to get these children the help that they need when they need it?
I think the way to strengthen it is to look at the facilities that are there, the training of the health workers, like the nurses, the clinical officers, whom I think is the backbone of the healthcare in this country. And we need to commend them. I mean, many of the ones that we have worked with, we see some very commendable work. There are a lot of clinical officers that at the health centers, they are able to do a good control of a pneumonia, the child gets well, but there are some times that their hands are tied because of some of the issues that require to be done, some of the prescriptions, some of the medicines that are needed. One may require to go to a district hospital or to a what we were calling a provincial hospital, and oftentimes to a referral or even ICU, because pneumonia can actually lead a child to go to ICU.
To ICU. Yeah. Okay, those are some of the available treatment options, but we're talking about an immunization. Have we been able to close, the immunization gap so that we talk about prevention as opposed to treatment?
Good. I think if I look at the treatment, the two major areas are the immunizations, those are the vaccines, and we really must support vaccination. I think from the supply that has been there, especially within what we call the KEPI. KEPI is a program that serves most of our children in immunization. We have done very well. There has been some gaps, and I must confess, when there was the nurses' strike, a lot of children missed their vaccination. And we are seeing some of the consequences of those strikes. So if we could avert getting to strikes, because if you have a gap of about 4 or 5 months, where children are not vaccinated, especially with vaccines that are important like measles vaccine, the whooping cough vaccine, it means that this child is vulnerable to be able to get that illness. So I think the situation has been corrected now, but definitely we had a gap, a very major gap that was noted.
What about, on the side of the parents? Because we've seen parents beginning the, immunization process, then somewhere along the way, they just get tired because there are too many, vaccines that we are talking about today as opposed to a decade ago.
Well done. That's a great question because we keep on hearing questions about the vaccine. Doctor, do I go for this vaccine? I mean, especially when polio is being given, the first question I get, or even a telephone call, we were given a vaccine 3 months ago. Should I go for this one? Maybe the way to put it is this, that the reason that you are seeing all these vaccines coming, they are dependent on what we call the morbidity or the pattern of illnesses. There are some vaccines that control, let me say, a disease like polio. If you got a polio vaccine, you did not get a vaccine for measles, or you did not get a vaccine for whooping cough, or you did not get a vaccine for TB. So when we look at the disease pattern, especially for children, a mother might apparently feel, oh, my child has gotten so many vaccines, especially there is one that we call a tetra or even a penta. A tetra, sometimes they have about 5 antigens together and they are given as an injection. Yeah. Or they have 6 antigens together. And when you tell the mother, I'm giving you something to prevent 6 diseases, some of them panic and they wonder, all those to my child?
Yeah, you start imagining you're pumping your child with too much
with
vaccines.
All that. Yeah. No, I think the dosages that are given to the children, the quantities, the level of what we call the antigens, they are useful. And I really am a major campaign of the vaccination because I see good results of children who are well vaccinated and very bad and poor results of those who missed. Like those who missed something like measles. You get a child with measles in the neighborhood. It's most likely that child is likely to get the attack of the measles than the child who was vaccinated. So
parents need to take their children for vaccination.
They need to take their children for vaccination. And that's a major plea I make. Even the current vaccine that's going on that has so many questions from some quarters.
The HPV vaccine,
the HPV vaccine. Yeah. Our girls should go for that vaccine. There are many benefits that have been noted in countries that did those vaccinations like Japan and Korea. I don't think we ought to let our children be exposed to viruses that could possibly be averted by a vaccine.
How do we stop, all the, the negative talk around vaccines that, we keep experiencing every time that, the government says we have this and that vaccine?
The negative talks will always be there. But it's unfortunate some of these talks do come from people that appears to say we have results, we have research and so forth. But apparently from the pediatric point of view, vaccines are important. Children should be taken for vaccines, and not only children, but any other person who should be vaccinated, like those girls of 10 years. I think they should get their vaccine.
They should get their vaccine. All right, as we prepare to mark, the World Pneumonia Day, what do we have to celebrate? Because the numbers don't look good.
What I would say that despite the numbers we are hearing about, I would want to be a little positive about Kenya. Kenya has made some very major contribution, even to the world, even in the care for pneumonia. If you may allow me to say that there was some work that was done here in the early 80s. And that work and the results that were found here, they were used by the whole world to be able to simplify the way that the pneumonia is diagnosed, such that a clinical officer or a nurse could be taught simple way of looking at a child and say, this child requires care at higher level. That was one work done in Kenyatta. Yes. Then there is this work I mentioned in Kilifi. Between 2009 and 2012, they've come up with very good results that are now used all over the world. So despite these numbers we are talking about, there is still some work that's going on, even in our hospitals, even in the counties. There is still some good control of pneumonia and other illnesses that we need to commend. Because sometimes I think as Kenyans, we want to talk of the bad things of this mortality, the deaths and so forth, without knowing. In those huge queues, a number of children are averted from getting pneumonia.
So how do we change the narrative to start beginning to see people talking positively about, these vaccines and also the need for us to work together to try and stop some of these diseases among our children?
I think the narrative would be changed by good health education, like what we are doing now.
Accurate information.
Yes, accurate information, and despite that negative narrative and all the issues we talk about, either the government or the councils or the governor, healthcare is an expensive program and a difficult, complex issue that cannot be answered in a day in terms of straightening it. The little that is being done still does some good in helping, but even the parents have their role in terms of the nutrition of their children, in terms of the shelter they provide for their children and the environment, and then taking their children for vaccination.
Checking their children for vaccination. All right, our time is up, but we do appreciate you finding time this evening to just come and shed light on how we can really try and stop the problem of pneumonia in our country. Obviously, we have a lot to do, but once the information begins to go out there, that is a step in the right direction.
I'll say thank you very much for those who are listening. I think we would want to live with a word of hope that with good nutrition, with good vaccination, and a good environment, our children are safe and they can continue on without the panic for pneumonia because it's a treatable disease.
It's a treatable disease. All right, thank you very much. Of course, we have been talking to Dr. Warurua Mugo, who is a child chest specialist, just sharing with us some of the things that are currently in place to try and ensure that we are able to reverse what we are seeing, the continued deaths of our children as a result of pneumonia, yet it is a preventable disease. This is where we put a cap on your health, but of course, business news is up next.